Hello everybody, today we are doing Module 6 from the fundamental book. Module 6 is infection control and prevention. I am on page 111 from Module 6. There are some key terms you need to know on this chapter. These are the key terms, and there's some more on this side. Infectious disease. Infectious diseases can cause pain, injury, disability, or even death. They help when pathogens such as bacteria, virus, or fungus enter a person's body and multiply. Recognizing when someone might have an infection helps you provide treatment and prevent the spread of the disease to others. Understanding how pathogens grow and spread will help you protect yourself and others from diseases. It's called chain of infection. It's in your book on page 114. It's listed in here. So to break the chain of infection, we have to use the standard precautions. Hand hygiene. Hand hygiene means cleaning your hand by hand washing with soap and water or using alcohol-based hand rub. You must make hand hygiene a constant part of your daily activity. Home care aides must wash their hands before performing any personal care task. Every personal care skill procedure includes the acronym SWIPES. It's listed here, so you can read it. Alcohol-based hand rub or hand sanitizers are another way to kill germs on your hand that you can use. However, if your hands are visibly dirty, soap and water are still the best choice. And when you are using hand sanitizer, you have to look at the product. It's advisable if it is 60 to 95% ethanol. And when you are applying on your hand, put a palm full of product in a cupped hand, enough to cover all surfaces. And you have to rub your hands together, covering all surfaces, and rub until dry. That should take about 20 seconds. Now let's talk about gloves. Gloves provide protection for you and the client. Proper use of disposable gloves helps you avoid spreading germs from one person to another. You must wear gloves all the time, but especially when you have a direct contact with blood, body fluids, or mucous membranes, or handling things that are contaminated with germs, or when you provide first aid, or if you have contact with a client who has an open wound, and things like that. Gloves are disposable. Most gloves are disposable. And gloves, they should fit well and not feel loose on your hand. And gloves be made of the appropriate material, usually latex, natural or vinyl, and they should not be peeling or cracked or discolored or have punctures or tears on them. After you put them, you have to look that, and you have to throw away after each use. And gloves need to be changed between tasks when they have become contaminated with germs or bodily fluids. PPE. We all know about PPE because of COVID. It stands for Personal Protective Equipment. PPE can help break the chain of infection. Masks or respirators and eye protection prevents cough, sneeze, and droplets from entering your eyes, nose, and mouth. Gowns or aprons keep your clothing and skin clean to prevent accidentally spreading germs to others. You should wear PPE when there is a potential for exposure of blood or bodily fluids from a client. If a client has symptoms of a confirmed infection, put PPE on before entering the room. As you can see, this guy had a full PPE on. Respiratory hygiene and cough etiquette. Practice respiratory hygiene to prevent the spread of pathogens through droplet transmission. Cover your mouth and nose with a tissue when coughing or sneezing. Or if you don't have a tissue, cough or sneeze into your upper sleeve or elbow instead of your hands. Wash your hands all the time. Okay, about sharps. Let's talk about sharp safety. There's always sharp things if you have like a diabetic client in your home, or if you have someone checking their blood sugar, or if there's someone who's taking medication with a needle. Syringe, needles, blades, lancet, and other sharp items can puncture your skin and expose you to the blood-borne pathogens. Many sharps come with built-in safety devices such as retractable needles or plastic cups or sheaths. One important sharp safety device is a sharp disposal container. These are strong plastic containers that cannot be punctured by a needle. They are usually red. I see them red a lot. Here it is. Be aware of where you might find needles or other sharps in your workplace. We have to handle needles safely. Do not bend, recap, or attempt to remove the needle from a syringe. Do not break any needles, or do not place used sharps immediately in the appropriate place or put the sharp things immediately in the appropriate container like that. Sharp safety containers should be disposed when the container is 3/4 full. Never overfill a sharp container. Another standard precaution that we can do to keep our environment safe is cleaning and disinfecting. Always wear gloves when cleaning contaminated surface and things. Treat laundry all the time. When you are handling laundry, treat them as soiled with body fluids or blood as contaminated. It's best to not mix one client's soiled linen together with another client's soiled laundry to minimize the spread of germs. Cleaning and disinfecting are not the same. Cleaning is cleaning with soap and water, or can be scrubbing that removes dirt and some germs. Disinfecting is usually we use a bleach solution or a commercial household cleaning solution, kills additional germs. You can make bleach in your home by mixing 1/3 cup of bleach per gallon of water. So all contaminated waste or garbages need to be disposed in the appropriate spot. You need to talk to your supervisor to see where is the garbage area. Okay, now let's talk about strengthening the immune system. As we age, our immune system becomes less effective at fighting infections. Making healthy choices for yourself and encouraging clients to do the same can help prevent infection. Healthcare workers should stay current on their vaccines. Because you work directly with clients and handle bodily fluids, you are more likely to get and spread the disease. Infectious diseases can be extremely dangerous. There are several ways that home care aid can prevent the spread of infection. Knowing and watching for the symptoms of common infection, like washing hands, following standard precautions, and using proper cleaning and housekeeping measures all keep clients and caregivers safe. Thank you. Now it's time to go to lesson 2, blood-borne pathogens. There are key terms on each section, in each lesson. It's good to know them and study them. Blood-borne pathogens and diseases. The 3 most common blood-borne diseases caused by blood-borne pathogens are hepatitis B, they call it Hep B, hepatitis C, HIV, AIDS. Syphilis and the West Nile virus are also caused by blood-borne pathogens. Okay, now let's talk about Hep B. Hepatitis B or Hep B is a viral infection that affects the liver. It's a more common infection and it's contagious. Approximately 90% of adults infected with HPV will recover. Some people exposed to HPV may not have any symptoms. You have the vaccine, that's a good thing. How about Hep C? Hep C is also a viral infection of the liver that may cause chronic inflammation with possible scarring or cirrhosis and cause permanent liver damage. CDC report that 75 to 85% of people who become infected with HCV will develop a chronic infection. There are no vaccines currently available, but there are several medications available to cure chronic hepatitis C. HCV and HPV can be spread through contact with dried blood. I'm gonna skip about HIV here because I'm gonna talk about it later. How blood-borne pathogens spread in the workplace. Blood-borne pathogens spread under special circumstances. However, not all contacts can spread blood-borne pathogens. A needle stick or other puncture wound is one, helping a client who's bleeding or helping to clean up blood, vomit, urine, or feces, and like that when you are in contact with the blood or things like that. Ways that blood-borne pathogens cannot spread. The first way is providing whenever you are providing a care with a blood-borne disease, you need to follow standard precautions. Sharing eating utensils, plates, and glasses with a resident doesn't cause blood-borne pathogen. Or sharing bathroom, or hugging, or shaking, or holding hands doesn't cause blood-borne pathogens. When do we expose to blood-borne pathogens? So it's listed in here. Anytime a person comes into direct contact with blood or other body fluids, there is a risk of exposure to the blood-borne pathogens. Home care aides should know what to do right away if they are exposed. So usually it's listed in here, type of exposure are listed here, and what to do are listed here. Now let's talk about HIV. HIV stands for Human Immunodeficiency Virus. It's a virus that attacks the body's immune system. If a person with HIV does not receive treatment, they can develop AIDS, which stands for Acquired Immunodeficiency Syndrome. There is no vaccine against HIV. Early symptoms of HIV may include tiredness, fever, diarrhea, large lymph nodes, loss of appetite, or night sweats. People with untreated HIV infection can develop many different health problems, like pneumonia, severe form of cancer, brain damage, nerve system, or extreme weight loss. How's HIV spread? I'm sure everybody knows. When infected blood, semen, or vaginal fluids and or breast milk enter the body through mucous membranes of the anus, vagina, or penis, or mouth, or through cuts, sores, abrasions on the skin, that's the way they get in. It seems like the highest concentration of HIV virus are in the blood, semen, vaginal fluid, and breast milk. Or having unprotected vaginal, anal, or oral sex with a person who has HIV can spread HIV. Unprotected sex is sexual intercourse without consistent or correct condom use, or using or being stuck with a needle or syringe that has been used by an infected person, like tattoo needles or ink and body piercing needles can cause the spread of HIV. It's also sharing of drug materials or giving birth, breastfeeding, receiving blood. All this can cause HIV. HIV is not transmitted through saliva, tears, sweat. You cannot get HIV from hugging, shaking hands, or sharing toilets, close mouth kissing, sexual activities that do not involve the exchange of bodily fluids or through the air. How HIV works in the body. How did we get it? How does it work through our body? Once a person is exposed to HIV, the virus enters the blood and attaches to a certain white blood cells called T cells. This picture is showing that. The role of T cells is to signal other cells to produce antibodies to fight off pathogens. Producing antibodies is a critical function of our immune system. With the HIV virus attached to the T cells, the antibodies produced to fight the HIV virus are unable to do so. Over time, HIV destroys the T cells in the body immune system. The destruction leaves the person vulnerable to opportunistic infections, cancer, and other life-threatening disease. How do we prevent HIV? Choosing sexual activities that don't involve contact with the body fluids, like semen, vaginal fluid, or blood, or using condoms, taking pre-exposure prophylaxis. Those are medicines people at risk for HIV take to prevent HIV. Or to be abstinence, not having sex, or to get tested and treated for STDs. Okay, what's AIDS, or acquired immunodeficiency syndrome? All people diagnosed with AIDS have HIV, but not all people with HIV have AIDS, because first you have HIV and then you get AIDS. AIDS began when a person with HIV infection has a T cell count below 200. Without treatment, a person has an average of 10 years between the time of the initial infection with HIV and the start of the symptoms of AIDS. There are only 10 years without treatment. Opportunistic infections usually poses little or no threat to people with healthy immune systems. But these opportunistic infections they are very dangerous for people who are diagnosed with HIV or AIDS. Okay, what's the treatment of HIV or AIDS? There is no cure for HIV, but it's treatable. In fact, most are able to take simple once-a-day medication to treat their HIV. It's called antiretroviral therapy, ART. That this therapy reduces the amount of HIV in the blood. Treatment can lead to a viral load so low that it's referred to undetectable viral load. When people living with HIV achieve and maintain undetectable viral load, they cannot sexually transmit the virus to others. This progress in treatment is called U equals U. The first U is undetectable and the second U was untransmittable. U equals U is a treatment as prevention strategy at this time. So any person exposed to the blood or body fluid of another person may need an HIV test. The time between when a person may have been exposed to HIV and when a test can confirm whether they have the virus is called a window period. The window period varies from person to person and depends on the type of test used to detect HIV. It can be as short as 10 days or up to 3 months. According to the CDC, you should be tested for HIV as soon as possible after exposure to kidney baseline. You must give a verbal or written informal consent for HIV testing. Testing can be either confidential or anonymous. HIV infection and AIDS are medical conditions that are considered disabilities under the Washington State Law Against Discrimination and the Federal Americans with Disability Act. This means it's illegal to discriminate against someone who has or is believed to have AIDS or who is HIV positive. Generally, infection with HIV can cause distress for those who have HIV and for those who cares for them. I think we are over here. So often caregivers may have similar feeling to the person living with HIV. Caregivers may experience the same isolation as the person with HIV infection, or finding a support system, including qualified counselor, can be just as important for the caregiver as for the person who has HIV. Most people, or some people with HIV or AIDS may become socially isolated, which can lead to loneliness, and other mental health issues, including depression and thoughts of suicide. There are some stigma associated with it too. People living with HIV may face negative attitudes and discrimination. This can cause harm and prevent the person from receiving the care and support they need. Always treat people with respect and dignity regardless of the HIV status. Maintain a client's confidentiality. Do not discuss their HIV status with others unless necessary for their care. Stop stigma. Thank you very much. Seems like we are done for the Model 6.